I am here with Dr. Ward, and we are talking all things eyes. Now, I feel like when I'm looking in the mirror, Dr. Ward, that's where I notice I am the most tired. Do you see that a lot with patients?
So the eyes, they're the window to the soul, right?
Yeah.
And so the eyes are often a central portion. And I think it's really important to talk about that because what I do as a facial plastic surgeon is really try to enhance people's eyes. So much of what we look at when we look at each other is looking eye to eye.
Right.
So it's often the first thing that we notice is like a little bit of sagginess, a little bit of droopiness, makes us look tired, and it interferes with kind of that self-image that we expect to see, that soul that we expect to see looking out at us.
That's so true. We want to look bright, we want to look awake. So are there options if we're feeling like it's getting a little bit saggy and droopy in the top area?
Yeah, so we all have excess skin here. There's always a little bit of excess skin. So you can directly remove that skin if it's kind of hanging down too low. But sometimes, in cases like me, I've got a very heavy brow. If you look how the brow kind of comes down, sometimes we just need to lift that up a little bit more to remove some of the skin.
Oh, so there's options of both. So what would it be called if we're doing eyelid surgery?
So the term is blepharoplasty, B-L-E-P-H-A-R-O, plasty.
Okay.
So that's just directly taking care of the eyelids. And that can involve a couple different components. One component is the excess skin that we might need to remove. But then also, a lot of us have these little fat compartments, or well, all of us do. But for some of us, those fat compartments are a little bit heavier. They make our eyes look even more tired. So that's an eyelid, or an upper eyelid lift is an upper blepharoplasty. And then the other one is a brow lift, where we're actually just lifting the eyebrows up a little bit higher. Now, it's not like the movies when you see like these crazy surprise things. You actually, we'd actually have a hard time achieving that even if we wanted to. It's usually a very subtle thing. And most of the people who have eyelid surgery don't look like they've had anything. Now, they just look rejuvenated or refreshed. It's not a dramatic sort of procedure.
Just you look awake.
Right.
And that's what you want, and refresh. What does the downtime look like? Does it range person to person if you're getting the eyelid surgery?
Yeah, it's 1 to 2 weeks roughly. You're going to have swelling, you're going to have bruising, of course, like you would with any surgery.
Sure.
But then the swelling and bruising will slowly go away. Now, occasionally it can last a little bit longer. Occasionally it can last a little bit shorter. But roughly 1 to 2 weeks is what most people plan on.
That's not bad at all, and the results are definitely worth it. What does it look like for surgery time? How long do we need to block out for surgery if we're getting that done?
So the surgery itself is about an hour, hour and a half.
That's it?
It's really short. So typically that is done with just a little bit of sedation, so you don't feel any of the numbing that goes on.
Okay.
You're sedated. We remove the skin. We remove any fat. If we need to lift up the brow, we do that at the same time. And it's just a great procedure. People are so happy with it.
Oh, that is so easy. Now, what about insurance, Dr. Ward? Does insurance ever cover these costs?
So in general, insurance will never pay for anything for just cosmetic purposes. However, if the eyelid skin or the brow is low enough that it's interfering with your ability to do normal activities throughout the day, whether that's driving, working on the computer, cooking, whatever it might be, then they will pay for it. Typically, you have to demonstrate that there's at least 30% obstruction of the visual field.
Okay, so if it's covering your vision, which is kind of important, you need to see, then it may cover it. And you guys are doing a free screening too coming up. Tell us about that.
Right, so we are really excited. We are doing a free screening with the machine that checks your peripheral vision to see if you're a candidate. And that's a $200 value. We're doing it absolutely free.
Amazing. That's so nice of you guys. Now, where can we go for more information and to book a consult right now?
Social media at WardMD or at our website, wardmd.com.
Perfect. Dr. Ward, thanks so much for all the info. Great to see you.
Thank you.